Okay, good night. And you have returned to 1524 LaVista Drive, Decatur, Georgia, United States of America. I'm on the second floor with our continual medical education, research, and I've chosen, as I would say, from random topics in medicine, in medical research. And tonight we are on the HIV and AIDS. Now, the first sign and symptoms of HIV infection, and pardon me, I'm your student Dolphy Gilpin. The first sign and symptom of the HIV infection is fever, and other symptoms include swollen lymph glands and sore throat. Now, at this point, the virus is moving into the bloodstream and starting to replicate in large numbers. Now, as we mentioned previously, there were three stages: the acute HIV, chronic HIV, and the full-blown AIDS. Acute HIV infection, chronic HIV infection, and the third stage was the full-blown acquired immunodeficiency syndrome. Now, the disease is usually asymptomatic or without symptom as it progresses to this AIDS or the acquired immunodeficiency syndrome. It becomes sort of asymptomatic, and that is without symptoms. And then it moves on back into a stage where it has some symptoms. Now, the AIDS symptoms include weight loss, fever, night sweats, fatigue, and recurrent infections. That means you could have other infections come along with it, and we have also related these other related infections, a group of STD infection, the hepatitis, the B and C, the chlamydia, and other recurrent infection can come along to complicate the situation. Now, no cure exists for this AIDS, but strict adherence to antiretroviral therapy, we call it ART, can dramatically slow down the disease progress and prevent secondary infections and complications, and subsequently prolong life. Now, it took 7 years after the first HIV was discovered to approve a drug to fight the HIV infection. Now, the FDA in the United States then approved, as a chemical name now, it was 3'-azido 3'-deoxythymidine, otherwise known by a generic name as AZT, or ZDV, which was azidothymidine, or ZDV, zidovudine, or azidothymidine. But the chemical name was 3'-azido 3'-deoxythymidine. Now, in the late 1980s and early 1990s, the HIV and AIDS was dreaded, very fearful, and it carried almost like a death sentence, with continuous suffering, with morbid outcome. So it was very, relative to today, it was very dreaded back in the 1980s. Late 1980s, early 1990s, when it was in its ice stage and there was only very few treatment options. Today, we have a variety of treatment options, but we'll get to that later on. Now, my personal research started about in 1990 at the BCC, Broward Community College campus, Davie, Florida, and also intermittently with Broward General Hospital and North Broward Hospital. It was where I first started my AIDS research, and intermittently in my infectious disease program between 1990 and 1996, when I was doing holistic special medical education research. Now today, as we mentioned, one can choose from nearly 41 different drugs. Over that, and about 25 different combination therapies to treat this AIDS syndrome. But back during the 1980s, there was not much, and like I said, the disease was very dreaded and very fearful, probably compared to like leprosy back in the ancient biblical times. You know, when you hear about this AIDS, it was very, very, it carried like almost a dead, continuous suffering sort of a sentence. And it was the talk of the time in the 1980s. But like I said, 7 years after the first case that a drug was developed by the FDA, the Food and Drug Administration of the United States, to approve this ZDV, zidovudine, or AZT, azidothiamidine, to treat this AIDS virus. And back then, nearly 2000, combinational therapy was chosen with lamivudine, azidothiamidine, and what the name of that one was? Abacavir. But we'll come on to that later on. We'll come on to that with our treatment options. We'll come on to all those various different combinational antiretroviral therapy, retroviral therapy. But right now, we're just continuing with the history and the stages and a brief overview of what to look for in the symptoms, and historically or chronologically what it was like in the 1980s, when it just the AIDS was very prevalent back there, late 1980s and early 1990s and thereafter. Modern treatment option, as like I said, offered us a variety of different drugs which are approved by the FDA, which was not available back there in the 1980s. And so, with this improved medical education, improved research, improved treatment option, we have had a better outcome in both treatment and also the response to treatment, giving us more longevity in life and giving us better grip and a better, it's not as fearful as it was back in the 1980s. In fact, it has become relatively latent now. I don't hear much about it, but HIV and AIDS is still around. And if you still don't do protective sex and do the required sort of preventative things that you are supposed to do, then you could still get the AIDS, and it's still, there's no full-blown cure found for it as yet. But we'll come on to more of it when we come on to more treatment options and stages and improved research techniques, as well as diagnosis and modern tests. So we're going to take a break, and we are going to continue with our CME, continued medical education research on the HIV/AIDS epidemic. HIV meaning human immunodeficiency virus, and AIDS meaning acquired human immunodeficiency syndrome. So we'll take a break and we'll come back with more on the AIDS, HIV, and the AIDS syndrome.